In a shocking decision, the Speaker has refused to grant an emergency debate on the tragic issue of drug overdose deaths and drug decriminalization in British Columbia. Remember, it was the NDP government of British Columbia who asked Justin Trudeau to decriminalize the use of dangerous drugs in public places all over the province. As a result, the number of overdose deaths has skyrocketed, and people no longer feel safe in their communities. We've heard just tragic reports of things like nurses having to forego breastfeeding their children because they're worried about the exposure that they face to from drug fumes in hospitals. The Minister of Mental Health and Addictions today refused to take immediate action, and as a result, Conservatives are calling on the government to hold an emergency take-note debate so that Minister Sachs can be held accountable for her decision today. Worse than refusing to take immediate action, the government has refused to rule out expanding this dangerous and extreme pilot project to other communities, most notably in Toronto. So they're refusing to rule out expanding this deadly policy to other communities in Canada. And that is why Conservatives believe that the Trudeau government needs to be held accountable to parliamentarians and are calling on the government to grant this emergency take-note debate immediately so that Canadians can hold this government accountable. I'll hand it over to my colleague to repeat that in French.
Dans une décision très choquante aujourd'hui, le président libéral de la Chambre a décidé de ne pas accorder un débat d'urgence sur la décriminalisation des drogues dures en Colombie-Britannique. Une situation qui fait en sorte qu'il y a près de 7 personnes par jour en Colombie-Britannique qui meurent des suites d'une overdose. Une situation qui est rendue telle que le premier ministre de la Colombie-Britannique, qui avait demandé à l'époque cette politique de décriminalisation, fait maintenant volte-face et demande au gouvernement d'agir maintenant pour mettre fin à l'hécatombe des overdoses en Colombie-Britannique. Des overdoses qui surviennent un peu partout, des drogues dures qui sont décriminalisées dans les endroits publics, les parcs, les cafés, même les hôpitaux. Ça ne peut plus durer. On est très choqués de la réaction de la ministre Sachs aujourd'hui, qui a refusé de prendre une décision immédiate sur cette demande du premier ministre de la Colombie-Britannique et de mettre fin à cette politique mortelle qui va continuer jour après jour pendant que les libéraux vont tergiverser à tuer des gens en Colombie-Britannique et partout au Canada. Et surtout, on est très choqués de la décision de la ministre Sachs de ne pas dire non immédiatement à étendre cette politique mortelle de décriminalisation à la région de Toronto. C'est pourquoi on demande au gouvernement d'accorder un débat d'urgence. Il a les moyens, il a le pouvoir, il a le devoir d'accorder un débat d'urgence en cette Chambre pour qu'on puisse tenir la ministre Sachs responsable de ses propos aujourd'hui et de cette décision illogique, inacceptable de ne pas mettre un terme immédiatement à ce projet pilote. Le gouvernement libéral doit prendre la responsabilité de toutes les personnes qui vont mourir pendant toute cette tergiversation. Merci.
We have heard so clearly in committee, as we've been studying the opioid crisis and the overdose crisis in our health committee, that the police do not have the tools they need to be able to act. In fact, we had Deputy Commissioner of the Vancouver Police Department talk about the fact that they do not have the tools to stop someone that is smoking crack cocaine on a beach beside a family. They don't have the tools to tell someone they can't smoke meth in a hospital by patients and putting nurses at risk. And what is the response from this government? They can't take immediate action. What we need right now is immediate action. We need the government to stand up and explain why they refuse to grant this exemption, the exemption to the exceptions that the BC government has asked for. This is an absolute failure from the Liberal government. This was a failure of an idea to begin with, and now BC is asking the Liberals to save them from the mess that they created, and we need to hear from Minister Sachs as to why she is supporting more people dying.
In British Columbia, we see the devastating effects of these failed decriminalization policies every single day. The Premier in BC, NDP Premier, asked the federal government in 2022 to sponsor and agree with decriminalization of hard drugs. Well, the facts are now in. In 2023, we had the most overdose deaths in 1 year we've ever had in BC, over 2,500. That's over 6 deaths a day, every single day. These drugs, and when we talk about drugs, we're talking about opioids, methamphetamines, heroin, crack, cocaine. These drugs are being used in playgrounds, in parks, in our hospitals. You have parents in British Columbia having to save their kids from needles cast on the ground at playgrounds. I mean, this is just not acceptable, and it's dangerous. So now the BC Premier comes to the federal government, comes back and says, this hasn't worked. It's not working at all. We're having such a public backlash. Please reverse this. We ask that today. Do it now. End these dangerous policies now. And the answer we got from the minister, 2 ministers, and the government is, well, not yet anyway. It's under review. 6 deaths every day while they delay their review. Then we asked for an emergency debate, and the Speaker turned that request down. I don't know what's more urgent than the death of Canadians. 40,000 Canadians have lost their lives to drug overdoses since 2015, and this government has been in power. So we're asking it to end now. We're now asking for a take-note debate. This is serious. It is grave. It is a matter of life or death.
Monsieur Berthold, j'ai écouté la période des questions et j'entendais la réponse de Monsieur Poilievre sur cette histoire de suprémacistes blancs. Êtes-vous gêné que votre chef ne condamne pas explicitement les partisans de la suprématie blanche et de l'anarchie?
Moi, je pense qu'aujourd'hui, là, on a vu les libéraux tenter de changer le sujet. On est devant une situation extrêmement grave. Actuellement, ce qui se passe en Colombie-Britannique, et vous l'avez vu aussi, au Québec, notamment dans une école, près d'une école à Saint-Henri, où les jeunes sont confrontés jour après jour, maintenant avec des seringues, parce qu'il y a eu un établissement qui a été installé près d'une école. Et aujourd'hui, justement, il n'y en a pas. Et ma réponse, c'est qu'aujourd'hui, je me concentre particulièrement sur la situation très grave qui se déroule présentement, sur le fait que le gouvernement devrait se concentrer plutôt à sauver des vies, plutôt qu'à faire de la petite politique, comme il l'a fait aujourd'hui à la Chambre des communes. Quand on demande d'avoir un débat d'urgence sur une situation qui fait en sorte qu'il y a 22 Canadiens par jour qui meurent d'une crise d'overdose. En Colombie-Britannique, c'est près de 7 c'est près de 7 gens qui vivent en Colombie-Britannique par jour qui meurent des suites d'une overdose. On ne peut pas se permettre de faire de la politique comme le gouvernement l'a fait aujourd'hui. On doit donner une réponse. On doit accorder ce débat d'urgence. La ministre Sachs doit prendre la responsabilité et répondre aux questions qu'on lui pose.
Ms. Goodridge, what is the Conservative solution to this? Because Conservatives have also, when you talk about concerns about public drug use, Conservatives also come out against things like safe consumption sites or drug testing where people can Conservatives support supervised consumption sites? I'm just trying to clarify.
There's nothing safe about those consumption sites.
Well, I call them supervised, but yes.
Well, thank you for that question. Conservatives have been exceptionally clear. We want to support treatment and recovery. These are important pillars. We believe that people have the capacity of recovering from addiction. We know and we believe in people, and we have a compassionate solution. I have to look to my home province of Alberta, where they are applying a recovery-oriented lens, where we are having a variety of supports in place, expanding treatment capacity, as well as still having many of those harm reduction supports in place. And I would question and point to you that they are not safe. They are supervised, and we need to be very cautious and careful in the language. And this is one of the challenges we have right now with the so-called safe supply, because the government is marketing it as if it's safe. We have kids on the street in British Columbia that go out and buy these dillies, and they call them dillies because they're dilaudid pills. And they call them dillies and they think they're safe because the government has said they're safe. And this is absolutely problematic. These are dangerous potent drugs, and we need to take that more seriously and more responsibly, and we have to be very cautious in the words we use. And so I will not buy into that idea that this is somehow going to be safer.
Just to clarify, what harm reduction strategies would a future Conservative government support? If it's not supervised consumption sites, if it's not things like safer supply, if it's not things like a decriminalization pilot, like what harm reduction strategies could you get behind?
Well, I reject the premise of that entire question because I didn't at any point in my statement say that I didn't support harm reduction. In fact, Conservatives in my home province of Alberta have been very clear in supporting harm reduction. We have a variety of supports available to people that are struggling with addiction, but it's done in a recovery-oriented lens so that people can get the support they require. But the end goal is always going to be to try and find recovery. And I think this is the challenge. This federal government does not believe that people are capable of recovering from addiction. And so they're offering palliative care as the first form of treatment, and that is absolutely unacceptable.
What does recovery-oriented lens mean then?
And to be fair, if you say Conservatives don't say they don't have a problem with harm reduction, what harm reduction would you be okay with?
So to answer your question, that's a really good point. So a recovery-oriented lens is building out a system so that people can find recovery and a variety of different off-ramps. And so having those kinds of supports in place, so whether it be a consumption site where people are asked, would you like support? Would you like to get better from this? Would you like a space in a detox? You know what, we can get you into that detox center. We can get you into treatment. Across this country, families are having to mortgage their homes just to be able to put their child into treatment. That is absolutely not the right solution. I'm very proud of my home province of Alberta and the work that they have done in reducing and removing fees for those access to those supports, which means that families can put their loved ones into treatment. That means that people have the ability to get better, and that's what a recovery-oriented lens looks at. It looks at a very holistic solution and trying to find as many off-ramps for people that are struggling with addiction to get the care and compassion they need to get better.
But some consumption sites do already offer resources for housing or for detox options. So what's the differentiation between what you would support and what the problem is?
Well, what you're pointing out is the fact that it's a patchwork, and not all of them actually believe that recovery is possible. And so I think it is very important, as we're going forward in this, that we continue to prioritize education, prevention of addictions. And this is one of the big challenges we have right now with this so-called safe supply, is that we are fueling the next addiction crisis by making more drugs available on our streets, and this is creating addiction in youth, and this is creating a problem that we'll then solve for. We could get much better if we simply reduced the number of drugs on the street, helped people get into treatment, and find recovery and support recovery as a space. Thank you so much.
Thank you. For sure you want the emergency debate after 15 months?